Using genetic testing for predictive purposes comes with a number of ethical dilemmas, issues. For example, um, some studies have announced research programs to investigate the use of genomic sequencing in the screening of newborns, as well as diagnosing conditions affecting these babies sooner. Genomic sequencing can also predict the development of rare inherited adult onset conditions, for example, such as some cancers. These informations that some healthy high-risk adults prefer not to know, while others cope by learning as much as possible. This is currently no consensus view on how inadvertent predictive testing, or in some cases, incidental findings, which may or may not have health implications sometimes in the future, should be managed, especially when testing would be performed at birth or during pregnancy. So, genetic disorder is a disorder which occurs in a human body due to irregularity in a person's DNA. That is why we often hear people saying that is it in your genes? This means the common traits or characteristics or even diseases can pass on to an individual at the time of birth from his parents. Genetic disorders are not curable, but can only be prevented. So that's very reassuring for us. Genetic disorder is one of several causes of infant mortality. In fact, 20% of the infant mortality in developed countries is due to genetic disorders. So we have a possibility and we have a hope. Every parent that desires their child to be healthy, and they could have a genetic counseling, and they could receive a genetic test, a carrier genetic test that has been developed as an important genetic test for family planning, which can help in identifying if the parents are the carriers of the genetic disorder, and also determines the risk of having an affected child. So this test needs to be conducted on both the partners, mother and father. So it's very rare, just 2% of all the population is a carrier of this genetic of faulty gene that is linked to recessive genes. For example, what happens in the case if both parents are found to be a carrier? Or, for example, in the cases where both partners are found to be a carrier of the same recessive gene, they can ask their specialist to have an pre-implantation genetic diagnosis, a PGT, so they can conceive and they have a chance to conceive a healthy child in the future.